This experiment features Banting and Best isolating hormone-producing cells in the pancreas. First, they tied the pancreatic duct of a dog. They waited 7 weeks for the pancreas to shrivel. While the other cells deteriorated, the hormone-producing cells remained in the islets of the Langerhans. The hormone was extracted from the pancreas and injected into a dog without a pancreas. Then the symptoms of diabetes stopped, meaning they successfully isolated the insulin hormone. Hi, science lovers! Welcome back to Science Now. Today, I have two important guests here with me today.
I'm Frederick Banting.
And I'm Charles Best.
Banting, I hear you discovered insulin with McLeod.
Well, actually, McLeod only provided us the laboratory and named the hormone insulin, but Bess was actually the one who helped me discover insulin.
Oh, I didn't know that. So, what is insulin?
So, insulin, along with glucagon, are hormones that are found in the islets of Langerhans, which was discovered by and named after the German scientist Paul Langerhans. And so, insulin is produced in beta cells, while glucagon is produced in alpha cells.
Exactly. Also, insulin causes the cells of our muscles, livers, and other organs to be permeable to glucose. Insulin also enables the liver to convert glucose into glycogen. On the other hand, glucagon helps the liver to convert glycogen into glucose.
Yes, both insulin and glucagon work together to maintain homeostasis in the blood glucose levels.
Wow, I did not know any of that. Thank you for sharing that.
No problem.
So this is a diagram demonstrating how insulin and glucagon work together to maintain homeostasis in our blood glucose levels. So after eating a meal, our blood sugar levels rise. And so then our beta cells release insulin into our blood. And then two things happen. Our liver converts glucose into glycogen. So then glucose in the form of glycogen is stored in our liver. And then our body cells become permeable to glucose. So what that means is glucose can enter our cells and also participate in cellular respiration, producing ATP. And so as a result of these two processes, our blood glucose levels decrease to their normal levels. So on the other side, after fasting or not eating for a long time, our blood sugar levels will be low. And so our alpha cells will release glucagon into our blood. So then our liver will convert glycogen to glucose. And recall that our liver here converted glucose into glycogen and stored that glycogen in the liver. So that stored glycogen is now converted into glucose and released into the blood. So as a result, our blood glucose levels will increase to their normal level. So in short, when our blood sugar levels are too high, insulin is released, and when our blood sugar levels are too low, glucagon is released. So that's how insulin and glucagon work together to maintain homeostasis in our blood glucose levels.
Hi, Miss San Lucas. So, after all your testing, you have developed gestational diabetes. Now, don't worry. The good news is it's temporary. It's only happens during 2% to 4% of pregnancy, so you're kind of special. The bad news is you're gonna have to watch a little bit how you eat, because if you do not, your baby might come out with diabetes type 1, which is not good. So what I'm gonna ask you to do is just, be more conscious of what you're eating, and you should be fine, because, it's temporary. Okay, does that sound good for you?
Yes.
Okay. Hello, Miss Two. What brings you here today?
So lately I've had really low energy. I've been really tired and sorry. I've been really thirsty too. And because of that, I've been peeing a lot. Like a lot. Yeah, I own a mukbang channel where I eat a lot of sweets. So I do have really bad eating habits. So I don't know if that has anything to do with that.
So what I'm hearing from all your symptoms, I think you might have type 2 diabetes. So that's, also referred to as adult onset diabetes. It's basically when the fat, liver, and muscle cells, they're just not responding to the insulin that your body makes. The cell is basically becoming impermeable to blood sugar. So some things you can do to change that around is you're gonna have to change your diet, your exercise pattern, and after we do some tests and we find out how bad it is, you might have to take some sulfonamides.
So what are sulfonamides?
So sulfonamides stimulate the isolates of Langermans in adults, but it's not as effective with type 1 diabetes, which is good for you. So yeah. So what I need you to do is cut out the mukbang videos. No more sugar, just a little bit. We're gonna want you to exercise some more and come back to me in 2 months and we're gonna see what progress you've made. Is that okay?
Okay.
Great. Hi, Miss San Lucas.
Hello, doctor.
So we've noticed that your baby's pancreas is not producing insulin. That means your child has type 1 diabetes.
What's that?
So that's basically when the pancreas is not producing insulin because of the degeneration of beta cells in the isolates of the Langerhans. It only happens in 10% of people, and it's usually diagnosed in early childhood.
Oh my God. What can I do?
Well, we're gonna have to put your child through insulin therapy. So basically what that is your child's gonna have to inject insulin into themselves for the rest of their lives. They're mostly going to have to do it around meal times because as we eat, our blood sugar levels go up. But we're also working on transplanting islet cells. So hopefully in the future, we can push past insulin therapy and we can go straight to transplanting islet cells into type 1 diabetes patients. Now, me and the fellow doctors here have put together a slide presentation basically describing what islets of the Langerhans are and transplants of islet cells.
Okay. Hello, now let's talk about transplanted islet cells. First, there are more than 2,000 tiny little islets, each containing thousands of cells scattered throughout the pancreas. This is the islets, and it is scattered throughout the pancreas. Now, back to diabetes and insulin. Although insulin injections provide regulation of blood sugar, they do not prevent all the complications that can come after. Also, the insulin therapy requires monitoring the blood sugar level and balancing injections of insulin. However, transplanted islet cells could replace the body's natural mechanism for monitoring and producing insulin. Like insulin therapy, islet cells transplantation holds the potential to reverse the effects of diabetes. One of the main barriers, there are always barriers and amazing things, but one of the main barriers to the successful clinical islet transplantation is immune rejection. Current anti-rejection drugs are toxic and they're very harmful to islet functions. Researchers and scientists said that the treatment uses a steroid-free combination of 3 drugs to prevent the rejection of the transplanted islet cells and to prevent diabetes from returning. The success of the treatment depends all on the new methods of isolating and transplanting pancreatic cells. Unlike other transplant surgery, this technique used for transplanted islets are non-invasive and have a lot of risks. Islet cells are extracted from the pancreas from the donor and infused into the liver of the recipient. And it is infused by a way of a large vein. The surgeon uses an ultrasound to view the large vein leading into the liver of the recipient, and the skin is frozen, and the syringe is used to place the new cells in place. Now, why is the liver used? The liver is used because when damaged, it is able to regenerate itself by building new blood vessels and cells. New blood vessels and nerve cells connect to the transplanted islets in the liver and eventually produce enough insulin to control blood sugar. Now, a challenge regarding these transplants is finding an affordable supply of insulin producing cells. Thank you for this presentation.
The adrenal glands are located above each kidney. There's 2 adrenal glands, one encased over each other. The inner adrenal gland is called the adrenal medulla, and that's regulated by the nervous system. And then there's one that wraps around it, and that one is the adrenal cortex, and the hormones regulate the adrenal cortex. The adrenal medulla produces 2 hormones, epinephrine, also known as adrenaline, and norepinephrine. The hormone-producing cells within the adrenal medulla are stimulated by sympathetic nerves in a time of stress. So let's say we get stressed, the epinephrine and the norepinephrine would help increase blood sugar levels to help us have enough energy to combat the stressful situation. The adrenal cortex produces 3 hormones: glucocorticoids, mineralocorticoids, and some sex hormones. So glucocorticoids are associated with blood sugar. An important glucocorticoid would be cortisol. An important mineralocorticoid is aldosterone. And I'm going to jump into a diagram and talk more in depth about these hormones and what they would do in a stressful situation. So the brain identifies a stressful situation in 2 ways. There's the short-term stress response and the long-term stress response. I'm not going to necessarily go into how they identify it, like all the steps. I just want to focus on the hormones and what they're doing. So for a short-term stress response, the epinephrine and the norepinephrine's response is that they increase the blood glucose due to the glycogen that's been converted into glucose. They increase the heart rate, breathing rate, cell metabolism, and the change in blood flow patterns that direct more blood into the heart and muscle cells. Now, in the long-term stress response, mineralocorticoids and glucocorticoids are there. So for mineralocorticoids, the increase in the amounts of sodium ions and water retained by the kidneys. They also increase in blood volume and blood pressure. And for glucocorticoids, they increase in blood glucose due to proteins and fats that are broken down and converted into glucose, and suppression of the inflammatory response of the immune system.